thank you for being here and the courage to come forward. I thank you, Patty. Thank you to all my colleagues to help put this hearing together. I hate to call it shadow hearing because we shouldn't be in the shadows. This is what drives me crazy, right? This is not a shadow issue. This is an issue for women across the country, which are 50% of the population or more, and their families and their loved ones, all of the above. And that's why our voices now matter more than anything. I want to also put a finer point on what is happening with Planned Parenthood, because it's not just about abortion care. Mm-hmm. Planned Parenthood provides so many essential services, and not just for women, but some men come to Planned Parenthood. So can one of you touch on that? The other essential services, if we have to close down because we're gutting Medicaid, the Republicans want to gut Medicaid and cut down Planned Parenthood, who, by the way, are in some of our rural communities, and probably the only health care we have in some of our rural communities, who is losing out? What types of services, and who is missing out on those essential health care services? I don't care, Dr. Baum or Minnie or whomever might want to touch on that.
We take care of everyone at Planned Parenthood. I myself I'm an abortion provider. I am also a proud vasectomy provider. And as we know, vasectomies prevent abortions. It's true. But we want to take away the funding for that as well. We provide sterilizations, we provide cancer screenings, we provide, general primary care. And a lot of times we are the only provider that folks can get to. And so again, you're exactly right. This is coming at it from taking away abortion access, but also taking away basic health care. Sexual reproductive health care is basic health care. The ability to control your own body, to determine your family, to control your fertility is essential.
Yeah, thank you. Please.
The discussion around Planned Parenthood is huge, and there's no question they provide absolutely essential health care services. But the Trump administration has been so smart to make this the central theme, because more than half the abortions in the country are provided by independent abortion providers. So we will get the overflow for abortion patients if Planned Parenthood closes. And how will we handle them? We're getting patients who travel I get a ton of patients from Texas, and then they get here and they don't have a hotel room or the money for a hotel, or they've got a hotel and they drove here, but they forgot about money for food, and they brought their kids with them. And so we're raising funds for them to get food, to get a hotel room, and to be able to get back to their state. I mean, we already have a crisis, and when you add the FACE bill to that, these people, I've also had people sleeping on our grass. We find them covered with mosquito bites, so then we need to go buy some medicine for them and take care of them for, they slept on a bench in the bus station. They were lucky they weren't sexually assaulted all night. And the problem is so complex, but they're coming after us piece by piece by piece. And that's what we really need people to understand. Even if they don't defund Planned Parenthood, and somehow this doesn't happen, the FACE bill closes all of us.
That's right.
Not just independent providers, but Planned Parenthoods as well.
Yeah.
And if they are allowed to shut down Planned Parenthood this way, they're going to come after all the providers now.
Yes.
Yeah.
They've already started, for decades, they've been, as you've really laid out, they've been harassing providers in order to disincentivize medical professionals from going into this work. Mm-hmm. So we already have a dearth of these professionals. We don't have enough capacity. We should be expanding abortion access. And I know so many states, and you've done such critical work to do that, we shouldn't be reducing the pool. And they're doing this because they actually know that abortions are going up in this country. So they're going to try to shut down abortion where it's legal by a lot of dirty tricks, including going after travel, which I know you've fought so hard. You've got this right to travel bill that's really, really critical right now. Anti-abortion activists are on the record trying to figure out how to shut down interstate travel, how to block folks from leaving states for care. because they know that we will get that care no matter what we have to do, and the advocates and providers in this room will fight like hell to get them that care.
That's right. You know, Nevada, I'm very proud of Nevada because in the 90s, there were some incredible, strong women in our state who actually used an initiative petition to codify Roe versus Wade in Nevada. And then we have just recently passed through an election, put it in our Constitution. That's how strongly we feel about it. And this is a swing state, right? Nevada is not a blue or red. It is a swing purple state, but people feel so strongly in Nevada about this freedom and the right of women. But you're absolutely right. It may be that Nevada, we have protected a woman's right to choose and her freedom over her health care. But what happens nationally and the fact that they are still coming after women's health care is having a chilling effect even in our state. For our doctors, when you are looking at across the country, even state legislation that looks to criminalize doctors for providing health care, let alone individuals traveling for that health care, has a chilling effect in my state. But here's the other thing I want to talk on because, Ms. Chilling, I think you're absolutely right. I think Lisa, my colleague from Delaware, put this perfectly. There's different pieces of the puzzle that they are attacking. When you put it all together, it comes down to being a national abortion ban. One of them I want to talk about, what hasn't been talked about yet, is EMTALA. And so I want us to talk a little bit about this because most people don't know about this law, which is a federal law that requires a hospital, emergency room, to provide care when a patient's life or health is at serious risk. They have to stabilize that patient before they can try to move that patient. It is an important law. It's been on the books for a number of years. And now what we see is an attack on EMTALA for individuals who need an abortion to stabilize them or for their health care. Into the previous administration, the president issued guidance, bless you, to the hospitals to say, here's how we interpret EMTALA, so you have to provide essential abortion care if somebody presents. Just recently, the Trump administration rescinded that guidance. And so I'm curious what you're seeing and hearing now from doctors, or even when there's emergency care, if they are taking that now, that rescission of that guidance, and is going to have a chilling effect on stabilizing women who come to emergency services in hospitals or wherever they may be to get that essential care. Are you seeing an impact yet on that? Because that is an essential piece of this puzzle as well.
So certainly. So I work with a large team of nurses that take care of all of our pre and post-abortion patients. And we just had this discussion the other day because they answer all of the after-hour phone calls. Somebody had an abortion, and like any procedure, there are going to be complications. And my nurses wanted to know, what do I tell people? What do I say? Do I say, oh, you're from a banned state. Is it okay to go to the emergency room? Do I have to tell you to come back, 10 hours to Illinois if you're bleeding? And I don't have good answers for them. We tell patients, you need to go get care, and I have to trust that providers in banned states will take care of my patients. But that's not always the case.
And the reason the Biden administration issued that guidance because we did see post-obs people being turned away from emergency rooms, and they had to take those states to court.
Yeah, and I'm going to finish here because I know Dick is an essential piece to our conversation here. But let me just say, and it's not just the Trump administration, it is the people he's put into office.
Yes.
If you have a Department of Justice that says, for FACE Act violators, we're only going to prosecute extraordinary circumstances, that has no effect on somebody who wants to stop a clinic or be there or protest. If you have Robert F. Kennedy Jr., who oversees CMS and the enforcement of EMTALA, who doesn't understand the law or what it means, they're not going to enforce these provisions to protect a woman's safety when they present at emergency care. So it is the people he has surrounded himself with. And they are just as crucial to protecting and fighting for women's health care in this country than the man who sits in the Oval Office. And if we don't get word out, if we don't organize and talk about this and talk about it to our friends and our neighbors and our loved ones, man or woman, they are not going to understand how literally our rights and our freedoms when it comes to women's health care is under attack, and they are all systematically doing it to actually achieve a national abortion ban at the end of the day. I cannot thank you enough for being here.
Thank you. Senator Blumenthal.